He's still muted. Dr. Tedros, can you hear me?
He's talking.
He's talking.
He's muted.
You are muted, Dr. Tedros.
Can you hear me now?
Ah, good. Go ahead, please.
I think there is a few minutes lapse, a pause time, I think. Okay. Good morning, good afternoon, and good evening. In the summer, Africa was certified as wild polio-free. This marked one of the greatest public health achievements of all time, driven by millions of health workers reaching every child repeatedly with an effective vaccine and a unique partnership between WHO, UNICEF, Rotary, CDC, the Bill and Melinda Gates Foundation, and Gavi. Global polio eradication remains achievable. However, the COVID-19 pandemic hurt momentum as polio and immunization efforts were suspended. This left children, especially in high-risk areas, more vulnerable to killer diseases like polio, measles, and pneumonia. And now we are starting to see outbreaks of this disease. We need to turn the tide quickly and ensure no child is left behind. Today, WHO and UNICEF are jointly launching an emergency appeal to rapidly boost measles and polio vaccination. While the world watches intently as scientists work to ensure safe and effective vaccines are developed for COVID-19, it's important to ensure that all children receive the life-saving vaccines that are already available. We estimate that $655 million is needed to address dangerous immunization gaps in children in non-Gavi eligible countries. This is a global call to action for all donors to stay the course and not to turn their backs on the poorest and most marginalized children in their hour of need. While the COVID-19 pandemic continues to evolve, we must take all opportunities to learn and improve the response as we go. Many countries heard our call back in January when we rang our highest alarm by calling a public health emergency of international concern. They worked closely with us and followed the parameters set out in the strategic response plan that WHO outlined on the 4th February. They have conducted reviews, shared data and experience, and honed their response to their national experience and unique situation on the ground. As the pandemic unfolds, as countries have reflected, they have used interaction reviews to make their responses stronger. This kind of self-analysis review is what the world called for during World Health Assembly back in May. An interaction review uses a whole of society, multi-sectoral approach, acknowledging the contributions of all relevant stakeholders involved in COVID-19 preparedness and response at the national and subnational levels. By reviewing and adapting the current preparedness and response strategies and identifying what's working well and what needs to be strengthened, the review gives countries the opportunity to change the trajectory of the pandemic. Interaction reviews not only help countries improve their COVID-19 response, but also contribute towards their long-term health security. To date, 21 countries have completed them and others are in pipeline. Today, we're happy to welcome the Ministers of Health from Indonesia, the Kingdom of Thailand, and South Africa to share their experience and lessons from COVID-19. I would like to first introduce His Excellency, the Deputy Prime Minister and Minister of Health of the Kingdom of Thailand, Deputy Prime Minister Anutin Charnvirakul. The floor is yours, Your Excellency.
Dr. Tedros, Director General of the World Health Organization, based on consensus. They highlighted the factors that helped Thailand successfully control the spread of COVID-19 so far. That include decisive leadership based on the base scientific evidence available, our strong public health system, and the strong whole of society approach across sectors. Cooperation and collaboration with all concerned sectors among the public and private sectors, civil society, and many institutions played important roles in breaking the chains of transmission. My highest appreciation is going to everyone in Thailand for their collective effort in curtailing the outbreak in our country. Besides our strengths, the review identifies that challenges for further improvement. First is to integrate information around COVID-19 and maximize its benefit. Second is to expand our surveillance systems by improving capacity to detect cases and increasing more efficiency of our emergency operations centers. Third is to advance the integrated digital data system for managing the situation and ensuring health security for everyone on Thai soil. Distinguished colleagues, IAR report reminds us the strengths that we need to maintain. At the same time, it advises us that the challenges we need is to address. We commit to improving our response to COVID-19 by working closely with relevant stakeholders. In this regard, I would like to thank all of our partners who have worked with us on the report, including WHO, various UN agencies, US CDC, and national colleagues in the academic sector. My special thanks is going to my colleagues at the Ministry of Public Health and all health workers who provide services across Thailand. Finally, I appreciate the role of the media and in disseminating and advocating news and information that helps us communicate with the public more effectively to prevent the spread of the disease. Only together can we win the COVID-19 pandemic, and we shall win. Thank you very much. ขอบคุณครับ
Sabadikap.
ขอบคุณครับ
So thank you so much, Deputy Prime Minister, for those insightful remarks and lessons regarding Thailand's response. I would now like to welcome His Excellency, Minister of Health, South Africa, Dr. Zwelini Mikize. Your Excellency, the floor is yours.
Thank you very much, Director General, my brother Dr. Tedros, honorable ministers, representatives from various countries in the departments of health, and members of the media and the public. I'd like someone to help me share the slides from your side, if that is possible. Thank you very much. I'd like to just take a quick walk through our journey on the COVID-19, and therefore I'd like to go to the next slide. The presentation is just going to give us a quick overview, and then why are we going to interaction review, what lessons have we learned, and the way forward. Next slide, please. This gives us a sense of the journey of the South African the fight against COVID. All the red lines there indicate how we've moved on the heavy lockdown and went downwards in a risk-adjusted way until we got to level 3. And then, of course, you'll see that that's when the surge started early in June, and then up to July when we're 13,000 positive tests per day. And then it started declining. And thereafter, when it was to plateau, went to the next level of the lockdown. We've continued on a plateau now. And at this point, we've even started opening up international travel. Next slide. At this point, we have got 1,500 to 2,000 daily new positive cases, 732,000 cumulative cases, 91% recovery, and 2.7% fatality rate, and 41,000 active cases. Thank you. Next slide. This is the toolkit. I think all of us have used this, from governance to case management to tracing to tracking to information to human resources and all the issues that we've had to employ. Next slide. Through this interaction review and on our own evaluation going back, we've learned a lot of lessons. Firstly, that the issues of national coordination, leadership, and governance with various structures become important. Evidence-based response is important to ensure that science leads everything. The strengthening of emergency procurement processes, excuse me, to mitigate against corruption. Strong primary health care is important. Issues of fatigue must be given attention to. Close collaboration with labor and other social partners. Public-private partnership is important. Harnessing of power of technology, digital contact tracing is also important, and information dissemination, and the issues of continued vigilance and aggressive response to cluster outbreaks, continued assessment of capacity of projected multisectoral and multifactorial impact. It's important to know that we need everybody to be touched by our response on this matter. The economic impact is a major issue the country and the citizens are caring for, and we believe the support of WHO has been very helpful to make us to be ready psychologically to face whatever comes as the next resurgence possibly comes up. Next slide. And here, learning from other countries that are experiencing COVID resurgence, measures have been taken to prepare for, detect, to promptly respond to the resurgence. There is a national plan now for action to mitigate COVID-19 resurgence, which has been developed. Provinces are currently developing their resurgence mitigation plans. It incorporates early warning systems, as I was saying, broken down right to the district level. And all the provinces now are remaining on high alert. And so every day as we watch, we look at where the clusters are breaking up. We've seen in the western part of the country, eastern part of the country. All of these are indicating our state of alertness. And this is now based on the plan from the WHO resurgence plan. Next slide. Here we've just got a quick indicator. Everyone has to look out for anything that's less than 10% increase or decrease is under control. Between 10 and 20, it puts us on alert. Now we're looking out for over 20% increase. That's indicating resurgence. And these are some of the key lessons that we have got from our intra-action review and the plans that we have developed together with the WHO as our partners. Next slide. So basically our recommendation is that intra-action reviews are valuable exercises that enable countries to recalibrate their responses. And in this case, in South Africa, it has really benefited us greatly. And the intra-action reviews provide great inputs for adjusting the system and plans for readiness for a potential resurgence, and the issue of continuous engagement with communities and all the partners at local and international level ensures that we are able to strengthen our non-pharmaceutical interventions, such as social distancing, wearing of masks, hand and respiratory hygiene. You need the community to respond at that level. And lastly, we still, the COVID-19 is still within us, and therefore need to remain vigilant to continue to fight together. We are quite clear that it needs an all community, all government, and everybody's participation to fight. And the strength of the intra-action reviews is to actually revive that understanding amongst all of us, so that as we move on, we are actually better prepared to respond. Thank you very much for the opportunity to share the ideas. Thank you very much.
Thank you so much, Minister Mikezi. Thank you so much for sharing South Africa's determined efforts to tackle COVID-19. I would now like to turn to the Minister of Health of Indonesia, Dr. Terawan Agus Putranato. Minister Putranato, the floor is yours.
Dr. Tedros, Director General of the World Health Organization, my fellow colleagues, Minister of Health from Thailand and South Africa, ladies and gentlemen, good morning, afternoon, and evening. It is a pleasure to be invited and participate in today's event. The Ministry of Health of the Republic of Indonesia, supported by WHO Indonesia Country Office, has conducted a national interaction review for COVID-19 response on 11 till 14 August 2020. The IER is an immediate follow-up of the fourth IHR COVID-19 Emergency Committee meeting recommendation that was held in July 2020. Surely it is not an easy task to bring representatives of 138 multi-sectoral stakeholders to conduct a review of the existing COVID-19 response activities in Indonesia. However, under the leadership of President Joko Widodo and the coordination of the COVID-19 Task Force Chief, General Luhut Binsar Panjaitan, representative from the technical unit within the Ministry of Health, other related ministries and government agencies, the national and regional COVID-19 task force, military and police forces, provincial and district government, hospital and primary health service facilities, laboratories, universities, professional associations, state-owned enterprises, and international organizations have been committed and been actively involved and contribute to the whole process of the IER. The involvement of the multi-sectoral stakeholder on the review is imperative in gaining a multi-perspective view of the COVID-19 response in Indonesia. This is particularly important because the IER in Indonesia covers the 9 key pillars of the COVID-19 response, which consists of the pillar of 1, command and coordination. 2, risk communication and community empowerment. 3, surveillance, rapid response team, and case investigation. 4, point of entry, international travel and transport. 5, laboratory. 6, infection control. 7, case management. 8, operational and logistic support. And 9, maintaining essential health services and systems. Indeed, active participation of such multi-stakeholder is a key for a success IER. Equally important, the multi-sectoral involvement in the IER has also increased the acceptability of the IER recommendation by all stakeholders. As a result, the IER recommendation have been used in the revised COVID-19 health sector operational plan at the national and subnational level, as well as in updating the COVID-19 partner platform. IER recommendation contribute to the improvement of the multi-sectoral stakeholder command and coordination at the national and subnational level. It also strengthened the periodic monitoring of response plan indicator, including surveillance and laboratory coordination, as well as improved contact tracing, testing, and triage at health facilities to avoid exposure of patients and the health workforce to COVID-19. Enforcing the implementation and monitoring of large-scale social restriction and empowering the community as agent for change through COVID-19, key messaging and engagement were also considered as one of the area for improvement. Furthermore, the IER suggested improving telemedicine to prevent COVID-19 exposure and maintain essential health services such as immunization, tuberculosis, HIV, and non-communicable diseases program. As part of ensuring the continuity of essential health services, Indonesia will also include the IER result as a reference for the HR State Party Annual Reporting in the 74 WHE. Ladies and gentlemen, Indonesia is of the view that reviewing the operation plan of COVID-19 response through the multi-sector stakeholder interaction review is one of the best practice to collectively identify best practice, gaps, and contributing factor for correction action in the COVID-19 response effort. From our point of view, the result of the IER review has provided input for Indonesia to improve multi-sectoral preparedness coordination in line with the multi-sectoral preparedness coordination framework that was published by WHO in May 2020 to strengthen coordination for a better health emergency preparedness. Thank you. Terima kasih banyak.
Thank you so much, Your Excellency. Terima kasih.
Hi, we are trying to connect with Dr. Tedros, so I hope it will be solved very shortly and quickly. Dr. Tedros, we lost you, but we are trying to fix the problem. Yeah. So we are trying to connect again with Dr. Tedros, but once we are trying to fix this, I would like to remind journalists to raise their hands if they want to ask a question, to get in the queue, and I would like also to ask them to unmute. Dr. Tedros is back, I was told. Dr. Tedros, are you with us? Dr. Tedros? Dr. Tedros, can you hear me? Yeah.
Can you hear me?
Yes, very well, DG. Go ahead, please.
After, I think, the interruption, it needs 30 seconds to unmute. That's the configuration. So I was hearing your voice, but not mine. Okay, so I was saying terima kasih to His Excellency Minister Putranato for sharing Indonesia's efforts to suppress COVID-19. Your Excellency, terima kasih again. By conducting reviews in real time and sharing lessons to the world, these three countries have reflected a blueprint for how countries can suppress COVID-19 and break the chains of transmission. You can do exercises, you can do simulations, but the best time to look at your emergency response capacity is when an emergency is happening. That's when you can clearly see what works, what doesn't, and what you need to improve. There is hope, and now is the time to double down on efforts to tackle this virus. Wherever a country is in terms of the outbreak, countries can turn it around by driving a whole of government and whole of society response. It's never too late. While we invest and test vaccines to prove they're safe and effective, I encourage all countries to learn from Thailand, South Africa, and Indonesia and work to suppress this virus today with the tools in hand that we know work. We can save lives and livelihoods and end this pandemic together. I thank you.
Thank you, Dr. Tedros and our distinguished guests. I will now open the floor to questions from members of the media. I remind you that you need to raise your hand by using the hand function, the raise your hand function, in order to get in the queue. And please make sure you are unmuted. And please reminding journalists to ask only one question. We will start the session, question and answer session, with Stephen Howard from Travel News Asia. Stephen, can you hear me? Stephen? Stephen, can you hear me?
Yes, hello, can you hear me?
Yeah, hello. You can ask your question. Please go ahead.
Hello, and thank you for taking my question, and thank you for all the work that the WHO does. My question is for Kun Anutin. Thailand is currently looking at reducing the quarantine from 14 days to 10 days. I would like to ask, please, what is the research behind this? When do you expect that to happen? And what are your thoughts on such a reduction, please? Thank you.
Thank you, Howard. Mr. Sharvira Kul, do you want to answer this question? Minister of Thailand. No? I think...
There's the WHO office in Thailand.
We are trying to contact again the Honorable Minister of Thailand. In the meantime, Dr. Van Kerkhoff can try to answer this question. Go ahead.
So thanks. While we try to get them back, there have been some questions about the quarantine period. Now, this is the time in which a contact of a confirmed case needs to be separated from other individuals. We call that quarantine. And WHO's recommendation on this is based on what we know of the incubation period, which is the time from exposure to the time that someone develops symptoms. Our guidance for incubation period is 14 days, and that's based on the amount of time that most individuals, 95% of individuals, will develop symptoms after exposure. And so what we've outlined is this 14-day period, and there are some countries that are discussing the possibility of reducing that time period based on a number of factors associated with their response and the capacity to provide supported quarantine. What we understand from a number of countries is that if they do reduce that 14-day period, they're considering adding testing as part of that. But there is a balanced approach that if there is a reduction in that 14-day period, there are some risks that are associated with that in terms of missing the potential cases onward. So what we have is our outline based on the science and based on what is understood to be that incubation period. That's where that 14-day comes from.
Thank you. The next question is for Kate Killand. Kate, can you hear me? Kate?
Hi. Hi, can you hear me?
Very well. Go ahead, please.
Hi, thank you for taking my question. I'm interested in what's happening with mink farms in various parts of the world. We've had a major cull in Denmark announced this week. And I wonder, is the WHO advising other countries that have mink farms whether they need to do similar things, close them or cull their herds? And are you also worried that this spread to livestock might happen with other types of livestock and with mutations happening and then it coming back into the human population?
Thanks for this question. So I will begin, but we also have Dr. Peter Benenberg, who's online, who's our animal-human interface focal point. So I will like to ask him to supplement this answer here. So yes, I'm sure you've seen the reports of the circulation of the SARS-CoV-2 virus in minks. We've been seeing this for a number of months now. And what we understand is the minks have been infected with contact from humans. It circulates in the mink, and then it can pass back to humans. And so there's always a concern when you have circulation and transmission from human to animals and then animals to humans. So there is a number of activities that are ongoing to understand the situation in Denmark. We had a very good call with our colleagues in the European Regional Office and ECDC and also the State Serum Institute in Denmark. And this is the group that is evaluating the strains that are being identified in these mink. And so the findings that they've found, they've seen some variants in some of these strains that have some mutations. And I'd like to remind you that mutations are normal. These types of changes in the virus are something that we have been tracking since the beginning. And you've heard me say many times that WHO has a global laboratory network, and we have a specific working group that is looking at virus evolution and looking at these changes. Each one of these changes, each one of these mutations, whether they're identified in mink or they're identified in humans, need to be evaluated because we need to determine the importance of each of these and if any of these changes means that the virus behaves differently. And there's a proper way to do that because there needs to be studies to evaluate if there's any changes in transmissibility or severity and if there are any implications for diagnostics, for vaccines, and for therapeutics. And in this situation, there's a suggestion that some of these mutations may have some implications, but we need to do the proper studies to evaluate this. And that is ongoing right now with colleagues at SSI in Denmark, as well as our international working group. We are working with our regional offices in Europe, in Wipro, and in the Western Pacific and in the Americas, where there are mink farms, because there are many mink farms all over the globe, and looking at the biosecurity on the mink farms, looking at the surveillance that's happening in these mink farms, and to support countries in taking the right steps to prevent the virus to continue to circulate in minks and to prevent spillover events from happening. So the immediate steps that are taken in Denmark is to limit further spillover of the virus, and then making sure that these minks are culled. And Denmark has made some announcements on how they are going to do that. But I'd like to ask Peter if he could supplement this by talking about how we work with FAO and OIE and our partners in support of this.
Thank you. Dr. Peter Ben-Mbarek, are you online? Peter?
Yes.
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 Please go ahead.
All right, thank you. Yes, we are, of course, working closely with our colleagues in FAO and OIE who have the more areas of expertise and specialty around the different animal species and the way they are bred and the risk associated with that. And it's clear that with mink, different countries have different farming traditions, and in some countries the farms are easier to protect in terms of biosecurity measures and so on than in other countries, and that explains partly why some countries have been able to control outbreaks in their mink population while other countries have had difficulties doing that. And to the second part of your question about the risk to see something happening in a similar way in other animal species, food animal species in particular, there the risk is much less for two reasons. Why is that the first studies that have been conducted on pigs, chicken, cattle, and so on show that these species are not at all susceptible in the same way that mink are, for example. So even if these animals were infected, they would not be able to sustain and spread the disease in the same way. And the second reason is that the way we produce pigs and chickens, in particular in modern farming systems, allow us to keep these environments totally isolated and secured from a contamination point of view. So it will be much easier to contain and prevent the disease coming into these environments if these species were also susceptible to the virus. Thank you.
Thank you, Peter. And I would echo your words there on biosecurity. Animals are farmed for all kinds of different reasons, and it is really important when they're farmed en masse that we have adequate biosafety, adequate risk management measures. This is an issue all over the world, and it's something we continually speak about. The animal-human interface is very dynamic. And it is even with having testing and having awareness of SARS-CoV-2, it's taken time to establish how widespread this virus has been in the mink population, and then human to mink and mink to human transmission. It just shows how complex and how dynamic this interface is, and how complex some of the answers are when you try to work out the significance of any one of these events. I think that is what the teams are working together, scientists all over the world, and on the epi side, on the clinical side, on the laboratory side, are working together with our Danish colleagues to establish those facts. We have briefed and worked very closely with our colleagues in the European Regional Office, with our Regional Director, Dr. Hans Kluge. We've also been in close contact with the European Centre for Disease Control. I know that this data are being sent around in the European Early Warning and Response System, and I know the European Union is acting. ECDC is the surveillance centre for the European Union, and I know the Danish colleagues are also reaching out across Europe themselves. So there's a lot of very good work and coordination ongoing, and WHO, we're just in the process of completing a first risk assessment on this specific event, and we will be communicating with our member states in the coming hours today. Thank you, Maria. In order to summarize the situation for all of our member states and any ongoing risks, we'd like to thank everybody from the country to the regional to the global level who are working with us. This is the work of science to establish the facts, to assess the risks, to manage those risks, and do that in a flexible, rapid and dynamic way.
Thank you, Dr. Ryan. I would like now to pass the floor to Jamie Keaton from Associated Press. Jamie, can you hear me?
Good morning. Thank you so much, Fadila. This question, there's so many questions to ask right now, but there's one that's really pressing, and I hope that Dr. Tedros can address it. As you may be paying attention, the United States is in the midst of an election, and President Joe Biden, or potentially President Joe Biden's administration, we may see. And I'm just wondering how much contact you've had with the with Joe Biden's team, and what kind of word have you had about whether or not, how quickly Joe Biden's administration would bring the United States back into the fold at WHO. Thank you.
Steve Solomon will comment on any specifics. We would just like to congratulate all Americans for exercising a wonderful act of democracy that's ongoing there right now, and to assure you that the World Health Organization is a member state organization. We continue to work with the U.S. administration, and we'll work with all U.S. administrations now and into the future. Steve?
Thanks, Mike. I can only reiterate that the Secretariat, based on principles of neutrality, works with all administrations. We will continue to work with the administrations in all of our member states and do so cooperatively and in accordance with the principles set down in the Constitution and any decisions that the World Health Assembly adopts in that regard. Thank you.
Thank you. I would like now to invite Adela Suleiman from NBC to ask the next question. Adela, can you hear me?
Hi there, yes. Just going back to the mink mutation question, I mean, you say you're doing a risk assessment and you're staying on top of it, but how worried should everyday people be? And secondly, will this dash any prospect of a real vaccine?
Sumia may wish to comment on the specifics regarding vaccines. No, I think it's very important to recognize that these types of things happen all the time. This is a global pandemic, and many millions of people are infected, and many millions of animals have been exposed. And we've seen different types of animals who've been themselves infected with this virus. And there's always a potential that the virus can then come back to humans. And that is a concern because mammal species like mink are very good hosts in a sense, and the virus can evolve within those species, especially if they're large numbers packed closely together. So in that sense, we have to look at that viral evolution. We have to create the biosecurity around farms like that so that there's not that contact back with human populations, and we have to address all of those issues. But no, right now, the evidence that we have doesn't suggest that this variant is in any way different in the way it behaves. It may have a slightly different signature, but it is still the same virus. What we have to evaluate over time is whether that virus has any difference in transmission or clinical severity, or whether there's any implication for diagnostics of vaccines. But we're a long way from making any determination of that kind. And Sumia may comment on the vaccine issue. I know this concerns people, but I believe we're a long way from making any determination there. But Sumia is an expert in this field, so I will defer to her knowledge and wisdom.
Maybe just to add to what Mike has said, I think it's too early to really jump to conclusions as to the implications of what these specific mutations have, either for transmission or for the severity of the disease, clinical presentation, or indeed for the immune response and potentially vaccine efficacy. So I think so far we've been tracking these mutations. As you know, we have over 170,000 whole genome sequences now in GISAID, and there's scientific work going on around the world. And WHO is leading a group as well that's looking. It's a group of evolutionary biologists and experts on bioinformatics that's constantly tracking these changes and mutations that are happening. And we've seen plenty of them. So I think we need to wait and see what the implications are. But I don't think we should come to any conclusions about whether this particular mutation is going to impact vaccine efficacy or not. We don't have any evidence at the moment that it would. But we will update you as we get more information.
Thank you, Dr. Swaminathan. I would like now to invite Laurent Siro from ATS, Swiss News Agency, to ask the next question. Laurent, can you hear me?
Yes, can you hear me, Fadela?
Very well. Go ahead, please.
Thank you for taking my question. There's been in the recent days a small controversy here in Switzerland about the solidarity between the different linguistic regions in the way hospitals and health centers accepts to treat people from other centers. So the solidarity between health centers. I'd like to know whether you have a global assessment on the way it works worldwide and maybe also in Europe. Thank you.
It's difficult to make any specific comment on a specific situation, but if we look at this globally, we've actually seen huge solidarity within countries and between countries, especially when it comes to the clinical care of patients. We've seen thousands of health workers go to areas to provide assistance when that was needed in particular areas, and we've seen transfer of patients out of areas to areas where they could receive better clinical care or intensive care as emergency rooms and intensive care units came under pressure in certain areas. The DG speaks all the time about solidarity and science, solidarity and solutions. We don't do good science without solidarity. We don't do good clinical care without solidarity. And frankly, we don't behave ourselves in communities to prevent the transmission of infection without that solidarity. We need to support each other as individuals, as communities, and within health systems. But our overall assessment globally, I would suggest, indicates a massive outpouring of scientific and healthcare solidarity and many federalised systems, putting aside the differences between the systems and any rivalries or difficulties and finding ways to help each other. It's not always easy because sharing resources in a crisis is tough when you're not quite sure how you're going to need those resources potentially in a few days' time. That is a very difficult thing to do. It's a very big step from an operational planning point of view, and also spiritually, just to offer others assistance when you may need those resources yourself. We encourage people to continue to do that going forward.
Thank you, Dr. Ryan. I would like now to invite the reporter from Jakarta Post, Ardila Svakria, to ask the next question. Ardila, can you hear me? Jakarta Post. Okay.
Hi, can you hear me?
Yeah, very well. Go ahead, please.
Yeah. Okay. Can I still address a question to Indonesian minister or?
Yes. Yes, he's still with us. Please go ahead.
Okay. Okay. So as Dr. Tedros said, the IR has allowed countries to learn about what worked and what did not work in the countries in terms of their response to COVID-19. I'd like to ask the minister, so from the IAR that Indonesia has conducted, what didn't work and how
Yeah. Ardila, you were cut off. Can you hear me? Ardila, can you hear me?
Hi.
Yeah, we lost you. Can you just repeat the last part of your question?
Okay, so I'd like what from the IAR that Indonesia has conducted, what kind of response and that didn't work in Indonesia, and how the government has been trying to improve it? Thank you.
Yeah, thank you, Ardila. The Minister of Indonesia, did you hear the question?
Ya, itu unmute-nya dibuka. Ya. Thank you very much, Adila, for Post. Jakarta Post. IER is intended to be a platform for continual learning. Based on the IER recommendation, we have expanded the laboratories network and referral hospital, as well as conducting massive recruitment of contact tracer and training for contact tracing. Ministry of Health and all of the government of Indonesia has conducted effort in the 9 pillars of the COVID-19 strategic response. The IER is served as a tool to review or respond systematically, identify strengths and gaps so that we can future improve or respond. One of the challenges during IER is because of large-scale social restriction. We have to conduct the IER via video conference. So there is challenge in engaging the participant of the review. However, we have managed to combine the IER with the use of participant perception survey filled by all participants that presented at the review. In this way, we were able to capture a more in-depth and comprehensive input from the participant. Thank you.
Thank you, Honorable Minister from Indonesia. We have now a journalist joining from South Africa, from City Press. You have the floor. I think it's Yuyo Madolo from City Press, South Africa. You have the floor.
Yes, good afternoon. Can you hear me?
Very well. Go ahead, please.
Hi there. It's actually William Mkhize from City Press newspaper in South Africa. I have a question for Minister Mkhize. He had spoken about the country having an indication of clusters of cases in certain areas. We've seen a report showing that in the Eastern Cape alone, there were 758 new cases on Thursday and growing hospitalizations. Is there a confirmed resurgence in that province? And can you talk us through that province's plan to mitigate against a resurgence and the factors that are influencing this rise in cases? Thank you.
Thank you, Yuwo. Honorable Minister of South Africa, Minister Mkhize, are you online?
Yes, thank you, sir. Thank you very much. So thank you for the question. Indeed, we are observing in a number of areas where there are cluster outbreaks that are showing the areas where we've picked this up, been in some areas such as in the Western Cape, in the Eastern Cape. We get these clusters and therefore we have to go in and make an assessment as to what extent do they constitute cumulatively what we should call a resurgence. So we are observing the fact that there is activity that is showing numbers that are a bit higher in some of the areas such as Nelson Mandela Bay and some of the border areas bordering the two provinces of East and West provinces, mainly due to some of the movement, particularly seasonal farm workers and so on. So there's work that's being done on a regular basis so that you can classify it as a resurgence when we've actually got all the factors properly evaluated. But there are clusters, we are looking at all of them, and at the right time we'll be able to indicate whether in fact there's something that requires additional action. The province has had quite an improvement in the Eastern Cape with the new team that was set in place to go and help to improve the response. And so over the past, since July coming this way, we have seen a lot of improvement, and therefore some of their capacity in terms of bed numbers, oxygen utilization have actually not really been ever exceeded. And so we do believe that if there's any change, we should be able to respond as we have done in the past. Thank you very much.
Thank you. I would like now to pass the floor to Mark Webster from CGTN. Mark, can you hear me?
Thank you. I'd really like to follow up on the Danish question. Mark Webster from CGTN. It really is, as I understood it, that this particular mutation doesn't pose any immediate danger, according to your experts. So therefore, presumably it would be totally premature to carry out a mass cull of mink.
Thank you, Mark. Yeah.
So thank you. I didn't actually hear a question in there. But what I can say is what is the situation as we know it, as we've described. So there are variations in these viruses that are identified in mink, and in the specific situation that we're talking about in Denmark is there's one virus variant that has been found in 12 individuals, 12 humans. And so what the authorities are doing is that they are looking for the extent of infection if there are other cases with this particular variant. And the reason that this variant is of concern is some preliminary studies which must be confirmed, and there are more studies that need to be done to really understand if there are any changes in the behavior of this particular variant, and if there are any implications down the road, as we have described as it relates to diagnostics, therapeutics, and vaccines. But there is a process that's in place. I mean, the question that was earlier was, what does this mean for the everyday person, and how worried should I be? I think what is important for the everyday person is to understand that there is surveillance that is ongoing, that is looking. There are sequences, full genome sequences that are being shared. And if anything I could stress today is that we need more sequences to be shared. As this virus continues to circulate the globe, as we see it in mink in different populations, those sequences need to be shared because they need to be evaluated, they need to be studied, they need to be discussed. And that needs to continue, and we need scientists to be able to continue to share those sequences. So that's really, really important. But in the current situation, what the Danish authorities have outlined are a series of steps that they have put in place to limit the ability of the virus, or these viruses, and there are different variants that are found in mink, to spill over and to pass from minks to humans, because we don't want to establish a new reservoir, a new animal reservoir for this virus. And so those are the steps that are being put in place, and also to make sure that we are still continuing to do surveillance in humans, increase sequencing capacity in many different countries. So I think that's what's important in the situation now, and for you to understand that there is a process in place to evaluate each and every one of these mutations to determine their importance.
Yes, and just to add, in terms of adding to your question about the decision of the Danish health authorities, and Peter alluded to this earlier, and this happens all over the world every day as we raise animals around the world. The issue in terms of the decision you make whether to cull or not cull is based on a number of things. Well, first of all, is the extent of that infection in that animal population. And the concerns you may have about viral evolution in that animal population, how efficient that particular virus is at spreading within that animal population and how fast it could evolve. The second is the biorisk management around those facilities. And there are many countries in the world in many situations. Peter referred to the pig and poultry farming sector, which have very strict biosecurity in place to prevent any virus jumping back into humans. So when you assess that biorisk and biosecurity measures in place. And then the third factor in making that decision are the implications for human health in terms of the likelihood of that disease causing more problems back in the human side in terms of severity or transmission or diagnostics. Those three factors have to be looked at together. It's not one in isolation. And the sovereign authority then has to make a determination between its veterinary and its human health authority on what represents the best decision for both veterinary health, for human health, and the Danish authorities are looking at all of that evidence. They're making decisions in real time. They're taking strong action, and we will continue to work with the scientific community to understand the implications of the findings. But in the meantime, the Danish authorities have to base their actions on the extent of the virus within that mink population, the biorisk management available around that population, and concerns around any health impact in humans. And as we've said, we've already seen a number of cases on the human side of the equation. And this is then going to take time to fully understand the implications of this, as Sumia alluded to, and that's our job. We have to get on with that on the clinical and scientific and laboratory side of things.
Thank you. I would like to come back to the first question from a journalist, Travel News Asia, asking specifically about the situation in Thailand. We have the Deputy Director from the Ministry of Health of Thailand who would like to take this question. Can you hear me, Dr. Tanaka? You are muted. Can you please unmute yourself? Yes, please go ahead.
Okay. Thank you very much for the question and give us an opportunity to answer this question. In Thailand, we plan to reduce the quarantine days from 14 days down to 10 days, but not for every country. We plan to implement it to the low-risk country first, and then after 10 days, the travelers can come out of the quarantine, but they still need to report to Ministry of Public Health, and they will have what we call limited travel. They can travel, but their schedule have to be reported to the authorities, and then they can travel to only a few limited spots, and they cannot go into the large gathering, or they cannot go into certain places where we still prohibited them to go. So that is our plan, to reduce the quarantine days to 10 days. And we hope that with this plan, we can still be very, very safe in taking the traveler into our countries and prevent the case from increasing as well. Thank you very much.
Thank you. I would like just to give the full name of the speaker, Dr. Tanarak Plipat. He is Deputy Director General, Department of Disease Control, Ministry of Public Health, Thailand. Thank you, Doctor. I would like now to ask the reporter from GG Press to ask the next question. Can you hear me?
Yes, I can hear you. Can you hear me?
Yes, very well. Go ahead, please.
Okay, thank you very much for taking my question. My question is about Taiwan, and I would appreciate if Dr. Tedros could answer this. Many countries and associations are again demanding WHO to accept Taiwan as an observer to the World Health Assembly next week. So my question is, I'd like to know if you are going to invite Taiwan as an observer to the meeting. If not, please tell us why. Thank you very much.
Thank you. I would like to invite Steve Solomon, Principal Legal Officer, to take this question.
Thank you. Thank you very much. And thank you for that question. The resumed session of the 73rd World Health Assembly will begin on Monday, so this question is very timely. But before I answer your question, and I will answer your question, related to that very importantly is the issue of technical issues, technical health issues. And on technical health issues, WHO works with everyone, everywhere, in Taiwan, China, everywhere. This helps ensure that there is no gap in achieving one of the principles of our Constitution. I'm going to read that principle because it is so important. The principle is that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. This principle is written into the DNA of WHO staff. So our technical work with Taiwanese health experts is very broad-based. It focuses on COVID. It focuses on a broad range of health areas. We've shared that with you. You can find a list of these areas where we cooperate technically with Taiwanese health experts and health authorities on our website. And that is available and that is kept updated. But I will take a moment just to give three important new developments in that areas of our work with Taiwanese health authorities. First, we are working with them through the COVAX facility. That is the facility that is designed to ensure equity with respect to the development and access to COVID vaccines. We are working with them through the Pandemic Influenza Preparedness Framework, which is a framework designed to strengthen protections and safeguards with respect to pandemic influenza. And we are working with them through direct discussions and conferences, and in fact, with Dr. Maria Van Kerkhove, we briefed Taiwanese CDC officials just this week, and that is an ongoing effort. Now, as to your question with respect to observership, that is participation in the governing bodies of the World Health Organization, particularly the World Health Assembly. What WHO is the key point to understand here. WHO is an intergovernmental organization. This means that countries make the policy decisions. The DG and the Secretariat must operate within the context of those decisions and in accordance with those decisions. In 1972, member states at the World Health Assembly passed a resolution which says that the People's Republic of China is the, quote, only legitimate representative of China to WHO. That resolution still stands. And Taiwanese involvement at the Health Assembly as an observer continues to be a question for member states. In fact, since 1997, this question has come up 14 times. And each time, member states have decided against inviting Taiwan as an observer. The question will come up again at the Assembly on Monday. There is a proposal for what is called a supplementary agenda item. That proposal is made by 14 member states. Again, if you're interested in that list of member states, it is on our website. That proposal is procedurally correct under the Constitution because this is an issue for member states. In sum, observership is a question for member states, and technical work of the Secretariat, of the Director General, with everyone everywhere, continues to ensure that we advance the principle of health for all as it's embodied in our Constitution. Thank you.
Thank you so much. This virtual press conference has been now in progress for more than an hour, but I would like to give the floor to Dr. Van Kerkhove for additional information.
Thanks, Fidel. I'll be very brief. Just to supplement what Steve has said on the interaction with Taiwan colleagues, scientific colleagues, there has been an active, really wonderful exchange with colleagues and scientists from Taiwan CDC and others. I've briefed them myself 4 times throughout this pandemic, and it's been an exchange of sharing, the global situation and some of the recent concerns we have, but also hearing from them as well how they've handled the pandemic and the current situation there, and then an exchange of lots of questions back and forth. So it's been a really good, very positive exchange. And also we have a number of scientists who are part of our technical networks, as Steve has said, and have been part of our technical networks throughout. So on a scientific level, it's really great. And we work with, as Steve has said again, and as the Director General said, we work with everyone, everywhere. We're all in this together, and we are all constantly learning from each other. So on the scientific front, the solidarity and the unity and the collaboration that we have seen in this is really heartening, and it will continue throughout. Thank you.
Before I pass the floor to Dr. Tedros, Dr. Ryan would like to say something.
No, I just wanted to just reflect for a second, and it was great to hear the feedback from the countries regarding the interaction review process. We'd just like to recognise the huge amount of work that's gone on inside our organisation with partners to develop the approaches and the methodologies to learn, adapt and implement from all of the work we've done before on preparedness, and to Landry Maigane, to Ludi Suyanto, to Stella Chungang. Thank you, Stella, for your leadership, and to Jawad Major, our Assistant Director General for Preparedness, because this is the work that goes on in this organisation day after day, week after week, year after year, building the capacity within countries to both manage the epidemic response process, but also prepare for epidemics. The approach in the IAR is a collaborative approach. It's about learning lessons, not casting blame. It's about doing better, not for after-action reviews and others. It's about doing better in the next pandemic. The intra-action review process is about doing better next week, next month. It's about saving more lives. It's about stopping more transmission. It's really important work. It can appear formulaic at times, but it is not. It is the essence of success in epidemic response. As great sports coach once said, if you fail to prepare, you prepare to fail. And in this regard, I just want to recognise the work of our staff and all of the partners in this regard. So that's important for me to say. I don't know, Stella, if you want to say anything on your role in driving this forward.
Thank you so much, Mike. As we've heard across from all the excellencies and the countries, the intra-action review is really an excellent and great opportunity to bring together every stakeholder from different sectors in a country to analyze collectively the successes, the strengths, but also the challenges that have occurred during the pandemic, and to course correct and to adapt their response. But it's also an opportunity to update and validate their strategic response and preparedness plans, and to document, apply lessons, and share with others. It is really important, as we've looked across the 21 countries that have already done their interaction reviews, that a number of strong success stories have come out, including the strong coordination and leadership that is needed at the highest levels, and the whole of society approach, bringing all sectors, including the communities, into the discussions. It is around the flexibility of and possibility of repurposing key staff and the workforce towards where the greatest needs are in terms of the pandemic response. It is about ramping up the diagnosis and the testing that occurs in countries, but not only ending there, following through with appropriate public health measures in terms of contact tracing, quarantining of contacts, and isolation of the sick. Some challenges too have come up across the 21 countries that have conducted IARs. And these, especially in the early phase of the response, where the lack of equipment, supplies, and robust supply chains and procurement processes have been identified as a challenge, and one that should be addressed in moving forward for other countries. But also the community levels, empowerment and participation, as well as the surveillance at the points of entry, providing timely information for evidence-based decision-making, and the ability to have in place business continuity plans, especially ones that would allow the provision of essential services and in the countries. So it is really important that countries continue to conduct the intra-action reviews, and that they continue also to integrate the findings into their strategic plans, but not only that, into their national action plans, as we see that many countries are actually facing concomitant outbreaks along with the pandemic. It is important also that countries should continue to share their reports and their experiences with other countries and with the global community. Thank you.
Thank you, Stella. Powerful words. And one last thing. I know, Fidel, you're going to kill me, but I just want to reflect and amplify one message from the Director General's speech, because so many hundreds of thousands of workers, millions of health workers and others have worked for decades to bring measles under control and try to eradicate polio. The appeal today been launched by WHO and UNICEF is close to the heart of so many national and international health workers. We've got so close in polio eradication. We're getting closer in measles, though we've taken a few steps back. We need to reignite immunization as a primary, the primary measure within primary health care. It is absolutely vital we don't potentially win a battle against COVID and lose a battle against polio or measles at the same time. Too many people have sacrificed too much. So I would just add my voice to the call today to use polio and measles as a way of reigniting our immunization systems. And in doing that, we will, number one, reach some very cherished goals that we have. Number two, we will build the power and the agility and the flexibility and the effectiveness of the immunization systems we're going to need to be able to be successful in the delivery and safe vaccination against COVID-19. These two objectives are mutually aligned, they're mutually supportive, and polio eradication and measles elimination represent some of the most cherished goals of mankind. So let's try to get behind the appeal launched by WHO and UNICEF today. Thank you.
Thank you, Dr. Ryan. I would like now to invite Dr. Tedros for final comments. Over to you, DG.
Thank you. Can you hear me?
Very well.
Thank you. So I'd like to, first of all, concur with what Mike and Stella have said. And I would also like to thank His Excellency, Deputy Prime Minister Charnavirakul, His Excellency Minister Mkize, and His Excellency Minister Putranto for joining us today and for sharing their experience on interaction reviews. Thank you so much also to all journalists who have joined us today, and see you in our next presser. Thank you. Have a nice day.
Thank you, Dr. Tedros. I would like just to remind journalists that we will be sending the audio file and Dr. Tedros' remark right after